The BLAST Tick-Borne Disease Prevention Program is a community-based health initiative designed to teach tick-borne disease prevention strategies and encourage early symptom identification. The program was created in 2008 by a team of researchers, educators, and community members in partnership with the Ridgefield Health Department. Funding was provided by the Connecticut Department of Public Health. There are approximately 20 tick species of major public health or veterinary importance in the United States and over a dozen tick-borne diseases that affect humans. We know that several diseases can be acquired from the bite of an infected black-legged tick, often referred to as a deer tick. Lyme disease is still most common, but health departments are monitoring the rise of babesiosis and anaplasmosis. Borrelia miyamotoi and Powassan disease are less common, but can have serious health consequences. It is possible to acquire multiple infections from one tick attachment. While there are other types of ticks in our area, which may carry other diseases, the black-legged ticks and Lyme disease continue to be our greatest health threat. Lyme disease was first identified in 1975 when a cluster of children and adults residing in the Lyme, Connecticut area experienced uncommon arthritic symptoms. A local mother, Polly Murray, is credited with initiating the medical investigation that resulted in the discovery of this new illness. By 1977, the first 51 cases of Lyme arthritis were described, and the Ixodes scapularis, or black-legged tick, was linked to the transmission of the disease. According to the Centers for Disease Control and Prevention, Lyme disease is the most commonly reported vector-borne illness in the United States, with over 300,000 new cases annually. In 2014, Lyme disease was the fifth most common nationally reportable disease, with 96% of confirmed cases reported from 14 states. The list includes all 6 New England states. While the criteria for reporting Lyme disease cases has varied over the years, we see a clear upward trend since 1995. These case maps, compiled by the CDC, clearly show that the number of Lyme disease cases has increased and the geographic distribution has expanded. Today, it's not uncommon to hear celebrities speaking about their struggles with Lyme disease. So, who is likely to get Lyme disease? Unfortunately, it's everyone living in or traveling to a Lyme endemic area. While we often think about Lyme disease when preparing for a hike or camping trip, most people are exposed to infected ticks just working or playing in their own backyard. Nationally, children, especially young boys ages 5 to 9, are at greatest risk. So exactly what is Lyme disease? Lyme disease is a bacterial infection caused by the spirochete Borrelia burgdorferi. This organism attacks various organ systems in the body, including the nervous system, sometimes resulting in Bell's palsy, meningitis, or jabbing pain, the activity system, causing arthritis, migratory joint pain or swelling, and the circulatory system, sometimes resulting in heart block or rhythm abnormalities. Lyme disease symptoms are often described as early and late. Early symptoms typically appear 2 to 30 days after the bite of an infected tick. The Lyme disease bacterium can infect several parts of the body, producing different symptoms at different times. Not all patients with Lyme disease will have all symptoms, and many of the symptoms can occur with other diseases as well. Early symptoms may include an expanding rash, often presenting as a bullseye, flu-like symptoms, fever, malaise, fatigue, headaches, muscle aches, and joint aches. Individuals who recognize these early symptoms and receive timely treatment often recover without any further complications. The rash associated with Lyme disease is called erythema migrans, or EM. This rash begins at the site of a tick bite after a delay of 3 to 30 days. A distinctive feature of the rash is that it gradually expands over a period of several days, reaching up to 12 inches across. The center of the rash may clear as it enlarges, resulting in a bullseye appearance. But, as you can see in these pictures of EM rashes, the shape can vary. It may be warm, but it isn't usually painful. Some patients develop additional EM rashes in other areas of the body. It's important to know that not everyone with Lyme disease gets a rash. But when it does appear, the rash is a clear indication of Lyme disease infection and should be shown to a medical practitioner immediately. We suggest taking a picture of the rash for your records. The late signs and symptoms of Lyme disease, which may occur days to months after a tick bite, often include severe headaches and neck stiffness, additional EM rashes on other areas of the body, arthritis with severe joint pain and swelling, particularly the knees and other large joints, facial or Bell's palsy, which is a loss of muscle tone or droop on one or both sides of the face, intermittent pain in tendons, muscles, joints, and bones, heart palpitations or an irregular heartbeat, known as Lyme carditis, episodes of dizziness or shortness of breath, inflammation of the brain and spinal cord, nerve pain, shooting pains, numbness or tingling in the hands or feet, and problems with short-term memory. Unlike many diseases, doctors can't rely solely on a lab test when making their diagnosis of Lyme disease. Lyme disease is diagnosed based on symptoms, physical findings such as the EM rash, and the possibility of exposure to infected ticks. Laboratory testing, according to the CDC, is helpful when used correctly. Diseases acquired from a tick in conjunction with Lyme disease are often referred to as co-infections. One of the most common is babesiosis, a malaria-like illness caused by a protozoan called Babesia macroti. This parasite invades and lives within red blood cells. Symptoms are mostly nonspecific, and the illness can range from very mild to very severe. Although most people will not have symptoms, if they should occur, symptoms may include fever, drenching sweats, and muscle or joint aches or pains. A blood test may find a breakdown of the red blood cells called hemolytic anemia. The other illness often found in black-legged ticks is anaplasmosis, formerly known as human granulocytic ehrlichiosis, or HGE. These bacteria invade and live within white blood cells called granulocytes. Much like babesiosis, symptoms are mostly nonspecific, and the illness can range from very mild to very severe. Most patients will experience a rapid onset of fever, shaking, chills, muscle or joint pain, and severe headache. Each tick-borne disease has its own diagnostic test and often a different treatment protocol, so it's important to understand exactly which tick-borne diseases a patient may have. You may have heard about a Lyme disease vaccine. There was a vaccine several years ago, but it was taken off the market. If you were previously vaccinated for Lyme disease, note that you are no longer protected. At the current time, there are no vaccines available for any of the tick-borne diseases, so prevention is key. When we think about prevention, it's important to understand how tick-borne diseases are transmitted. So we'll start with learning what black-legged ticks look like. The black-legged tick goes through 4 stages in its life. The nymph, the stage responsible for the greatest number of Lyme disease cases, is less than a quarter the size of the adult female. The adult female is about the size of a sesame seed. The nymph is about the size of a poppy seed. Both the nymph and the adult female can transmit Lyme disease. The nymph is responsible for the greatest number of cases because it is very hard to spot and out in the environment during summer months. Larvae may not transmit Lyme disease, but do transmit other diseases. Tick eggs hatch in the spring. The ticks feed 3 times in their 2-year life cycle. Tick larvae feed on mice, moles, or birds, known as hosts, in late summer. Larvae and nymphs can acquire the bacteria which causes Lyme disease when feeding on these infected hosts. The white-footed mouse is the principal reservoir for the infection. Nymphal ticks feed in the early spring, and adult ticks feed and reproduce in the fall and winter. Adult female ticks lay approximately 2,000 to 3,000 eggs per tick in leaf litter in the spring. Lyme disease patients are most likely to have illness onset in June, July, or August, and less likely to have illness onset from December through March. But it is possible to encounter an infected tick whenever you're outdoors and there is no snow covering the ground. Cases are reported year-round. Ticks like damp, shady areas under ground-covering plants such as pachysandra, myrtle, and ivy. They can be found near stone walls. Ticks often hitch a ride on a small rodent such as the white-footed mouse, so you'll find ticks in areas that mice find attractive. Dead tree trunks and branches, tall grasses, and the wooded edge of your property are also places that you may encounter ticks. Stay away from leaf litter, too. Ticks spend 95% of their life in the leaf litter on the forest floor during their 2-year life cycle. Tick populations can also be abundant in areas where deer live. Deer supply ticks with transportation, a place to mate, and a blood meal. Be wary of ticks in places where you see a lot of deer or deer droppings. Some deer ticks look larger than you might expect because they've been feeding. The term engorged refers to a tick that has fed and is filled with blood. An engorged deer tick may fool you as they can expand to the size of a small raisin and are often mistaken for dog ticks, which do not carry Lyme disease, but may carry other infections. The term tick bite may be misleading as ticks do not bite like a mosquito. Ticks attach and feed gradually. Once a tick has found a place to feed, it grasps and begins to cut into the skin. The hypostome penetrates and the tick secretes a cement which holds the mouth parts in place while the tick feeds. This cement is one of the reasons ticks may be hard to remove. Irritation may occur at the site of the bite and should not be mistaken for the EM rash. Remove a tick from your skin as soon as you notice it. Use fine-tipped tweezers to firmly grasp the tick very close to your skin. With a steady motion, pull the tick's body away from your skin with a slow, steady force. Avoid crushing the tick's body. If the tick's mouth parts remain in the skin, don't be alarmed. They can't transmit the Lyme disease bacteria once separated from the tick's body. You'll want to remove them with the same care you would use for a splinter. Always clean your skin with soap and warm water or alcohol after removing a tick. Place the tick in a plastic vial or Ziploc bag for identification and testing. Always record the date and location of a tick attachment on your calendar. Consult with your physician and watch for early symptoms. You may have heard some recommendations for removing ticks that are not effective and may actually increase the risk of pathogen transmission. Don't squeeze or rupture the tick. Don't pour kerosene or nail polish remover on the tick. Don't rub Vaseline or petroleum jelly on the tick. You want to avoid doing anything that might otherwise traumatize the tick. Your goal is to remove the tick swiftly and carefully. After a tick is removed, you may want to consider having it tested to see if it's positive for any of the tick-borne diseases. It's important to know that even if the tick is infected, it doesn't mean that the infection has been transmitted. There are many factors involved in this process. Local health departments, universities, and private labs offer tick testing services. Never wait for tick testing results before seeing your physician if you suspect that you've contracted a tick-borne disease. So, how do you avoid getting a tick bite? The BLAST tips include those recommendations science has shown have the greatest potential to reduce your chances of contracting a tick-borne disease. These are easy, affordable ways you can avoid ticks and their bites in your daily life. You don't have to travel far to find a tick. The B in BLAST reminds us to bathe or shower soon after coming indoors. Data from a study conducted by the Connecticut Emerging Infections Program at the Yale School of Public Health has shown that people who did not contract Lyme disease were nearly twice as likely to shower or bathe within 2 hours after spending time in their yards. Bathing washes off unattached ticks and provides the perfect opportunity to do a thorough tick check. Ticks may still be on your clothing, so put clothes in a hot dryer for 10 minutes if they're dry or 50 minutes if they're wet. Washing clothes alone does not kill ticks. The L in BLAST reminds everyone to look for ticks and rashes on your body after coming indoors. Finding and removing an attached tick as soon as possible may reduce your risk of getting the disease, so the sooner the better. Check under your arms, in your ears, the belly button, behind your knees, even between toes, all of the places where a tick may go undetected. Ticks are very small and may feed anywhere on the body, so look thoroughly. Tick bites are usually painless. That's why people are surprised when they find a tick attached to them. Do a tick check every night, and while you're looking, check for expanding rashes too. A stands for applying repellents to skin and/or clothing. The CDC recommends using repellents that contain 20% to 30% DEET on exposed skin and clothing for protection that lasts up to several hours. Always follow product instructions. Parents should apply this product to their children, avoiding hands, eyes, and mouth. Another option is to use products that contain permethrin on clothing and gear. Treat shirts, pants, socks, and shoes when you're not wearing them. Spray outdoors in a well-ventilated area and allow the clothing to dry before putting these items on. Permethrin remains protective through several washings. Pre-treated clothing is also available and may provide longer-lasting protection. Scientists are also studying the effectiveness of all natural chemical compounds made from plants that can repel or kill ticks. Some that have shown promise include an essential oil from the leaves and stems of the wild tomato plant, an essential oil from garlic plants, essential oils from Alaska yellow cedar trees, some herbs and citrus fruits, and a fungus that grows naturally in soils throughout the world. S explains the recommendation to spray key areas of the yard that harbor ticks. Research has shown spraying for tick control can be very effective. According to the Connecticut Agricultural Experiment Station, a single perimeter spray in the spring can reduce the number of ticks in your yard by 80 to 90%. This should be a high-power spray targeting tick habitat areas. Concentrate on the yard perimeter where the lawn meets the wooded edge, stone walls, and dense ground cover plantings. Be sure to spray several yards into bordering woodlands. You do not need to treat short, well-manicured lawn areas that are in full sun. Ticks are found in shady, moist, untended areas. Watch out for leaf litter, wood piles, and invasive plants such as barberry bushes that provide a safe habitat for rodents and the ticks they carry. Recognizing that most people become infected with tick-borne diseases close to home, researchers have focused on understanding all of the effective ways to reduce the number of ticks in your own backyard. These include clearing tall grasses and brush, adding a 3-foot wide barrier of wood chips or gravel between lawns and wooded areas, mowing the lawn frequently and raking leaves, stacking wood neatly in a dry area, keeping playground equipment and patio furniture away from yard edges and in a sunny location, choosing deer-resistant plants, removing plants that harbor ticks, and not feeding wild animals and birds on your property. The T in BLAST reminds us that animals suffer terribly from tick-borne diseases too, and often carry ticks into the home on their fur. Pets, especially dogs, can be seriously impacted by tick-borne diseases. Unfortunately, vaccines are not available for all of the illnesses dogs can get from ticks, and they don't keep your pet from bringing ticks into the house. For these reasons, it's important to use a tick prevention product for your dog or cat and to check your pets daily for ticks, especially after coming indoors. Ask your veterinarian about the ticks found in your area, vaccines, topical products, collars, and other prevention methods available. Don't allow pets to sleep on your bed, as ticks may crawl off the dog or cat and onto a family member. Cats are extremely sensitive to a variety of chemicals, so don't apply any insecticaricide or repellent to your cat without first consulting your veterinarian. Tick bites on pets may be hard to detect. Signs of a tick-borne disease may not appear for 7 to 21 days or longer after a tick bite, so watch your dog closely for changes in behavior or appetite if you suspect your pet has been bitten by a tick. Symptoms may include fever, lack of appetite, lameness, and joint swelling. Now that you know more about ticks and the diseases they carry, we hope these prevention recommendations will become part of your daily routine. Please take a few minutes around the dinner table, at the office, or at school to share what you've learned. Encourage the people you care about to avoid tick habitat, dress protectively, bathe after outdoor activities, check daily for ticks and rashes, use repellents, safeguard their yards, and protect their pets. With your help, we will tackle tick-borne diseases. Have a wonderful day. The information in the BLAST program is based on recommendations and research from the following sources: the Centers for Disease Control and Prevention, the Connecticut Agricultural Experiment Station, in particular their Tick Management Handbook, the Connecticut Department of Public Health, the Westport Weston Health District, and the Emerging Infections Program at the Yale School of Public Health.